All right, we are recording. Technology, very cool. So, Grace and I talked before class. If anybody has a question or clarification, because I sometimes don't remember to check the chat, so Grace can kind of help me keep up with the chat. But if there's any questions in class, Grace can be your advocate. Just, ask any question or clarification, and then she can ask me on the computer and I can clarify. All right, let's get into this virtual session. So a couple points to remember. We analyze motion joint by joint, and we do that as a strategy because a lot of times with human movement, a lot of things are happening and it could be overwhelming and confusing. And then the second thing is we just want to make sure that we don't use global landmarks. We want to keep it local. We want to keep it within us. We don't want to say extension is when chin goes up, because I don't have to move my cervical to have my chin go up, right? Like if I lean back, my chin could go up and my neck stayed in the same position, or vice versa. Remember that on the first test. So we always want to make sure we use our local landmarks. Today, we're going to emphasize the cervical vertebra, and we're going to bring it eventually back down to the trunk. So it'll be good practice, but also a continuation of our progress for exam 2. So our cervical vertebra is a continuation of our overall spine, obviously. Our trunk was our thoracic and our lumbar combined to make our tree trunk. It's kind of where we get that word: bend to the right, bend to the left, twist to the right, twist to the left. And then obviously it can bend forward and back. We call that trunk flexion, trunk extension, right lateral trunk bending, left lateral trunk bending, right transverse, left transverse. The landmarks we wanted to use for a local reference was our sternum and our pubis, right in the middle of our right and left hemipelvis, the pubic bone right there. So our sternum, when it's lined up and in anatomical position, if I flex, those two are going to get closer. If I extend, they're going to get further away. If my right shoulder gets closer to my right hip, right lateral. If my left shoulder gets closer to my left hip, left lateral. And remember, traditionally, you've been taught it looks like it's moving, and it is. So for the sake of the trunk, flexion looks like flexion, extension looks like extension. But the bottom part of the slinky can move about the top. And so like if you were doing a reverse crunch, that would be flexion. Like if this was a regular crunch, flexion, reverse crunch, still flexion, because you still get the same change. Flexion, reverse crunch, trunk flexion. So just as a summary, today we're going to go up to the cervical. So the cervical, or like if the spine was a tower, right, a tall building, the cervical would be the top 7 floors, because remember you have 7 cervical vertebrae. And the vertebra, the cervical top, bottom, bottom, top, but just coming from the bottom, since that's how we've been teaching it, the cervical start where your ribs end. So you have your first rib right here, and then you have your 7 cervical vertebrae that connect to the base of your skull, right? And so the cervical independently. So in other words, you may say, well, why didn't we say thoracic and lumbar? Because that was a combinational movement from those sets of vertebrae. Thoracic have ribs, lumbar don't. On top, the vertebrae that don't have ribs, we can move them independently without moving thoracic at all. In other words, we can isolate just the cervical vertebra to have movement. So for the positive is that all of our motions have the same root names. We have cervical flexion, cervical extension, right and left lateral cervical bending instead of trunk, right and left lateral cervical, and then right and left transverse. So the verbiage is basically the same. The area changes, thus we have to insert cervical when we talk about the neck moving around. Our landmarks, where do we want to use for local references? Okay. In the sagittal and transverse plane, super easy. Chin and sternum, chin to chest. I like to say chin to chest because it kind of assonance, chin, chest. Some people might use nose to sternum. So basically, in anatomical position, straight line. If my chin is anywhere looking on the right side, my right side of my sternum, I have to be twisted to my right. And if my chin is anywhere to the left side of my sternum, I have to be twisted to the left. And when I say twisted, rotated, right? Right transverse cervical rotation, and I'm rotated to my right transversely, left to come back, left to leave. So our verbiage for like a full range of motion would be right transverse cervical rotation from, left transverse cervical rotation to, left transverse cervical rotation from, right transverse cervical rotation to. If you remember, I can be east of Lafayette, but be traveling west. So if I'm all the way, if I'm at my full range of motion, right transverse, I can be rotating to the left, but still be rotated to my right. Make sure we understand that difference in verbiage. I can be spinning to my left, but my position is still to the right of my sternum. Grace, just kind of glance around and make sure you see some nods. I can be spinning back to the left, but still be positioned to the right of my sternum, because position and motion are two different things. Motion is change in position, and position is literally a point in space. Where are you at? Different from where you're going. Okay. Now, laterally, our landmarks that I like to use are ears and shoulders. Right ear gets closer to right shoulder, right lateral. Left ear gets closer to left shoulder, left lateral. So what's happening is this. That's like, okay. So let's use our verbiage for a full range of motion. Right lateral from, left lateral to, left lateral from, right lateral to, right lateral from, left lateral to, left lateral from, right lateral to. The illusion would be, I don't know if anybody's ever seen those owls, like those birds where their eyes are fixed on a target and people will move the bird and like their head doesn't move. That's kind of weird. But that's what happens when you're trying to fix your eyes on something and your body has to move for whatever reason, sports or activity or fight or flight. Your body may want to move. And if your head didn't recurve back, your head would go along for the ride. And all of a sudden, your eyes are slanted. They're not in a normal level position. When our eyes are level, that's how we are used to processing the world. So if you've ever noticed, when you go out to the side, you get a little unbalanced, you get a little wobbly because you're not used to processing data like this. And you have, you guys remember from anatomy, like semicircular canals, which are like equilibrium levels in like your inner ear and stuff. That also gets kind of twisted and shifted. So we want to keep our eyes level. So one way our body can do that in the frontal plane is when our body does this and our head bends back, kind of like with the trunk. If you guys remember, we did that with the trunk and the pelvis. So this would be an example of right lateral, because instead of my right ear getting closer to my right shoulder, I just had my right shoulder get closer to my right ear. So in other words, this would have been anatomical in a straight line, and I bent back this way. That makes sense. So that's what I love about landmarks. I don't like looking at increasing or decreasing angles because that in itself can be confusing. I'm decreasing the angle on this side, but I'm increasing the angle on this side. So why don't you just keep it with landmarks? Right ear closer to right shoulder, left ear closer to left shoulder. It's saying a similar thing, but much less confusion. Okay. Right lateral bending, left lateral bending. Right lateral to anatomical, right lateral from, left lateral to, left lateral from. Cool. Okay. The last one we've already had on our first test. cervical flexion and cervical extension. Cervical flexion is going to help you get more in the fetal position with your cervical. So chin gets closer to chest. Cervical flexion, chin gets further away from chest. Cervical extension. And the illusion, we actually did that on the first test, right? Where your whole body went forward. I think it was the martial arts example where they were bowing. And if they wouldn't have moved their cervical vertebra, when you lean forward, you'd be looking at the ground. So you have to extend, your chin has to get further away from your chest, again, to keep your eyes level. So that would be an example of the illusion of it looks like it didn't move because your eyes stayed level, but your brain wants to say it stayed level relative to the room. It's a global reference, and we want to work our way out of global references and look at local references. Chin, chest, ears, shoulders, nose, chin, sternum. Okay. All right, now what we're going to do is bring all this stuff together and do cervical and trunk as combination examples. And we're all going to get to practice this and do it. And again, Grace, just kind of facilitate if someone doesn't understand what I'm saying. It's not your fault. It's me. So what we're going to do is we're going to make sure we're sitting in our chair. What that's going to do is make sure our pelvis doesn't twist unless we swivel our chair. So we don't want to swivel our chair, okay? What we want to do for this first example is take our trunk and we want to twist our trunk or rotate our trunk to our right, but we don't want to move our cervical. We want it to go along for the ride. In other words, I want my chin to stay lined up with my chest. I want you to see that it might look like my neck is spinning to the right, but if I didn't deviate between my chin and my chest, it just went along for the ride. So in other words, my trunk rotated to the right and my cervical, which is on top, is just going to move with it. So I didn't have cervical motion here because my chin is still lined up with my sternum. But my sternum is now looking at my right hip. Remember our landmarks, here to here for cervical, here to there for trunk. Okay, so we're rotated to our right. We had right transverse trunk rotation. We did not have any cervical rotation. It might have looked like I was moving, but I didn't. And I used landmarks to show me the way. Okay. Now, from this position, so we're rotated to our right, I want you to now rotate just your cervical vertebra back to your left. And I want you to look straight ahead like you were when you were sitting in anatomical. And I just want you to notice something. Notice that now you are looking at your left shoulder. Your sternum is looking at your right hip, and your chin is looking at your left shoulder. Grace, look around and make sure we're good. Trunk is twisted to the right. My cervical is twisted to the left. Okay. Now let's go back to anatomical position. And I want you to see what that would look like if I move my trunk and my cervical the same way at the same time. And I want you to see the illusion here. I'm sitting down. My trunk is in anatomical. My cervical is anatomical. I'm going to rotate my trunk to the right. And it looks like my neck didn't move, but it had to move. Because if it didn't move, I would be here. So because I was able to keep looking forward, that shows me, and not only that, but my landmarks, that as my trunk had right transverse trunk, my cervical had left transverse cervical. And I use my landmarks to prove it. Sternum is now looking at my right hip. Chin is now looking at my left shoulder. That's how I prove it. That's how you know. That's why you don't have to guess on the test. You're going to be able to see it. You're going to be able to know it. Let's go the other way. This would be left transverse trunk, right transverse cervical. Do you notice a pattern? When we did the pelvis and the trunk, there was opposition there, right? Cap and bottle effect. It's the same concept, just raised up to the next segments of the chain. Left transverse trunk, right transverse cervical. Now, first of all, any questions? Any follow-up questions? So far, so good? Good. Can the cervical and the trunk spin the same way? Absolutely. And there's a functional reason to do so. If I wanted to look behind me and I couldn't move my hips or my feet, I'm not an owl. I can't literally spin my head 108, 360 degrees around. But what I could do is rotate my trunk to the right and my head goes along for the ride, and then rotate my cervical vertebra to the right. And I can summate those motions functionally to get my eyes 180 degrees around for me to look. So there's no rule that you have to have the cap and bottle. The cap and bottle is when you're trying to cancel things out. Your body goes one way, but you want to stay looking another. But sometimes you want to look behind you. And so your cervical will spin with your trunk so that you can summate those motions and have functional, I call it a functional circle of sight. In other words, my head can't spin 300, 180 degrees, but the combination of maybe my pelvis and my hips and my trunk and my cervical can get me to look 180 degrees behind. The sum total of those pieces can add up to practical motion. Okay. All right, let's do some more practice. So if I were to start, let's say I start off in this position, okay, we should be able to identify that I'm left transverse cervically rotated, okay? From here, now my sternum is facing you, my trunk is in anatomical, okay? Let me try it this way. So I start off by I'm looking at my left shoulder, so I'm left transverse cervically rotated. And then from here, you see this. We're going to do a practice. I'm not asking you about my trunk. I'm just asking you to analyze cervical. This is my start position. And this is my finish position. Let's use our clues that you learned in class. Take a few seconds and try to tell me what motion you observed from A to B. I'm going to give you a minute and I'll be right back. Right. So I started off left transverse cervically rotated. I ended in anatomical. The only way, that's like saying again, I started in Breaux Bridge and I ended in Lafayette. You know how you had to travel on I-10. If you start off twisted to your left and you end in anatomical position, the only way that can happen is to have right transverse cervical rotation to anatomical. And I could have continued it. I could have did a full range of motion. I could have started to my left and done right transverse to, and then right transverse from. All I did was this. But instead of moving the top about the bottom, I move the bottom about the top. I move the bottle about the cap instead of the cap about the bottom. Okay, let's do another one. We'll go frontal plane this time. I start off in this position and I do this. Oops. To start. Finish. It's Halloween. This kind of looks creepy. It's kind of like Michael Jackson. Start. Use landmarks. Use landmarks. Start position. Finish position. And go. It's going to be stuck in my head all day. Boom, 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 boom. Well, it is October. Okay, are we good? So again, use landmarks. I say don't. I just want right answers. If you can see the motions happening with these illusions, that's awesome. But if you're like me and it's like, I overthink, I'm not quite sure, that's the beauty of using landmarks, because it gives us a start. It gives us a process. All motion this is basic physics, high school physics. Displacement or motion is just change in position. That's all it is. And then when you make it relative to time, you get velocity. And when you make that relative to time, you get acceleration. But the essence of displacement is change in position. That's all we're doing. We're just saying, where are we at? Grace, help me out. Did I start off with tilted to my left, or did I start off tilted to my right? I think I started off to my right. Is that correct?
You started out this way and then you changed it to this way. So
Okay.
maybe
Gotcha. Gotcha. Okay. So we'll do both. It doesn't matter because we're practicing, but I start off bent to my left. How do I know? If I froze my neck, despicable me, right? My handy dandy imaginary freeze Rick. Yes. And if I froze my neck and brought my body up vertical, I'm tilted to my left ear close to the left shoulder. Does that make sense? So I'm tilted to my left. My left ear is closer to my left shoulder. And then it gets further away. And now my right ear is closer to my right shoulder. So I had right lateral cervical bending. Left lateral cervical bending. Right lateral to, right lateral from, left lateral to, left lateral from, teeter totter. Cool. And then the last plane is cervical. And then I have a couple cool practice that we'll do with trunk and cervical. So the illusion here is, looks like it's moving, and it is. Chin, chest, that's where we're going with landmark wise. If I go back like this, start, finish, instead of literally bringing my chin to my chest, all I did was bring my chest to my chin. So it has to be the same motion. A to B has to be the same motion as B to A. And notice how it has different global spins. That's what messes with our minds, because we want everything that spins this way to be called something, because that's how you were introduced to it. But in the human body, if this is flexion, this must be flexion, because we get to the same place. Okay, so this cervical flexion is the exact same as this cervical flexion. This cervical extension is the exact same as this cervical extension. Flexion to, flexion from, extension to, extension from. Remember, hyper is excessive. You can have hyperextension if you go beyond a normal range of motion, or you can have hyperflexion if you go beyond a normal range of motion. So it's just normal range of motion. You should have a normal range of extension for a majority of your joints. There's some joints that in anatomical position, that's as far back as you can go. Those are the ones where we can say, well, technically anatomical, you are extended because you're at the end of your road. You can't go beyond it. Any motion beyond that would be hyper. And I think that's where I'm repeating myself, but that's how I teach. I think that's where we get confused because, like, our elbow in anatomical is extended because we can't extend from anatomical at our elbow. So when you have a hyperextended injury, it's extension from anatomical beyond normal range of motion. You're not supposed to have your elbow go like that. And then we take that because the elbows and the knees, most common, injured joints, but knees especially. And we say, well, if this is hyper of the knee, well, then every joint must have hyper from anatomical. And that's not true. And wrist can extend from anatomical. That's not hyperextension. That doesn't hurt. Hyperextension would be. Remember, guys, you get your money's worth. Free sound effects. All right, let's do this practice. This is going to be I'm going to give you a full minute or so for this one because this is a challenging one. First, let's set the stage. I want to start. That's why I gave it to you earlier. I want to start with my trunk. So I'm giving you the starting positions. My trunk. And this is what I love. If I didn't rotate my trunk, you wouldn't see my clothes change. Remember, there's clues in the clothing. Watch the difference. This is me moving my pelvis and my trunk goes along for the ride, and me moving my trunk. Do you see the difference? When my thoracic and lumbar vertebra actually rotate, you see it in the clothing. So this is a really good example, practice example. So let me set the stage. My trunk is rotated to my right. Sternum is looking at my right hip. My cervical is rotated to my left. First example we did. From this position, you observe the following. I'm putting my fingers on my shoulders just to emphasize the motion. I am telling you that we had trunk motion. I'm giving it to you. The clues should be in the clothing, but you can't see my pelvis. So I'm giving you the fact that I had trunk motion. I want you to analyze the potential motion. Maybe there wasn't anything. Zero is an answer. No motion is an answer. But I want you to analyze the motion potential at my trunk and my cervical in this example. I'm giving you the start. My trunk is twisted to my right. My cervical is twisted to my left. And then I want you to observe the change and the new position. Where was I at? Where am I at now? How had my joints have to move to get to the new position? To me, that's the safest way to do it. That process is going to lead to less mistakes as opposed to just looking at the change without analyzing the change in position. One more time, and then I'm going to give you a minute. Trunk rotated to the right to start off with, cervical rotated to the left to start off with. We established that at the beginning of class. You observe this. And I'm asking you to analyze the potential motion of the cervical and the trunk. Go. Grace, just give me a heads up when it looks like everybody's done discuss. Again, I want people to take their time. This is one of those good practice where you can really use your analytical tools and skills. But when you think everybody's done having a conversation, and like I always encourage, talk to the person next to you. Hey, what did you get? This is what I got. What did you get? If you got the same thing, great. Still doesn't mean you're right, but at least you can start a conversation where, oh, we got different things. Well, why did you say this? Well, why did you think? Ah, I see. And I always say I'm suggesting my way because I feel it works. And I've gotten over 20 years of experience listening to students, their perspective and their insight and things that they struggle, can potentially have problems with. But it doesn't mean you can't do it your way if your way is getting at the same place as my way. If our metaphorical change in position gets us to the same place, you can take whatever route you want. Just want to make sure we end up in the same destination.
Y'all okay with this one? All right, we're ready.
We analyze motion joint by joint. So how about we start with the trunk? Well, we could start with the cervical if we wanted to, but we do joint by joint. My sternum is looking at my right hip. I'm right transverse rotated to start. When I'm done moving, my sternum is looking at my left hip. So my change in position was right rotated to left rotated. And the only way that can happen is if I have left transverse trunk rotation. So my trunk rotated to the left transversely. Okay. If there's no questions about that, let's analyze cervical. My chin is looking at the left side of my sternum. So I start off twisted to the left, and I go from twisted to the left to twisted to the right. Now my chin is on the right side of my sternum. The only way to go from left transverse rotated to right transverse rotated is to have right transverse cervical rotation. If there's no questions, I'm going to show you what that meant if we did the motions one at a time. And so maybe this will help unlock some of this confusion. So basically, I did trunk and cervical at the same time. But in reality, what happened independently, one at a time in sequence, is left transverse trunk, right transverse cervical. I just did them at the same time. Or right transverse cervical, left transverse trunk. Gets me to the same place. I just did it at the same time. Left transverse trunk while right transverse cervical. Looks like that. Any questions or clarifications?
Yeah, I think they're understanding it really well.
Yay, that's awesome. Okay. So again, repeatability, just make sure we're analyzing the person's perspective. In biology lab, you would have to identify a bone. And so the right humerus is the right humerus for all of us, even if it's on your left side. So just please, that's one of the biggest accidents, that if you see this, it's my right to right. And if you were standing right next to me, we would do the same motion. We'd both do this if we were standing side by side. But if you're here and I say, okay, on the count of 3, bend your ear to the right, do this. So just remember, I'm sorry, if you were looking at me and I said right ear, right shoulder, it would look like this for you and this for me. So just remember, it's the person you're analyzing. It's their injury, it's their rehab, it's their muscles, it's their bones, it's their joints, it's their motion. Some students will, to remind them of this, they'll put maybe like right and left in the top corner of your scratch paper, just so that when you see this, you don't think you're left. It's the person who's moving. We make sure we analyze, okay? So if there's no further questions, I'll end this lecture and I'll let Grace kind of work with you guys if y'all want to do some extra practice on pelvic and trunk. What I was hoping though is that the landmarks of the sternum and pubis for trunk to pelvis, all we're doing is just raising it up, and we're just doing it at another level, chin to chest, chest to pubis. And we also want to make sure we understand, or at least acknowledge, that it doesn't matter if my pelvic, like in other words, it's not chin to chest to pubis. Like that's a leap that doesn't articulate. It's here to there because that's what articulates the cervical, and then here to there because that's what articulates the trunk. That would be like using a hand landmark with a foot landmark to look at the knee. No, like it has to be the landmarks that connect or articulate the joint itself. Okay, so you don't have to worry about nose to pubis. That you're bypassing what connects the cervical to what connects the trunk. Chin to chest landmarks here, sternum to pubis landmarks there. And if you stick with these local landmarks and practice, you cannot be tricked. You can't be tricked. Okay. All right. Any last questions before I let you guys practice with Grace? I will. Go ahead.
I think we're all set.
Yay. I will see you guys in person on Wednesday. Okay.
Thank you, Dr. Campbell.
All right, guys. Y'all have a great day. Take care.